Ever wondered how external factors can influence the effectiveness of your chosen birth control method? In this eye-opening video, we're addressing the burning questions you might have about oral contraceptive pills. Are there certain medications that can interfere with their efficacy? Can pre-existing health conditions play a role? By now, you might be wondering, how do certain medications interfere with OCPs? What specific illnesses can reduce their efficacy? How can I ensure I'm getting the most out of my contraception method? Well, you're in the right place. In this video, we've delved into these important questions and provided you with valuable insights that can help you make informed decisions about your reproductive health. Life's journey is full of unexpected twists, and Laura's story is a testament to that. Join me in this heartfelt tale of determination, surprises, and the undeniable truth that even the most diligent plans can sometimes take an unforeseen turn. If you've ever wondered about the complexities of contraception and the unpredictability of life, this story is for you. Join us as we unravel the mysteries and provide you with the knowledge you need for a well-informed contraceptive journey. Laura. Laura, a young woman in her early 20s, was navigating the complexities of life, love, and contraception. In a world where choices were abundant and decisions were pivotal, Laura found herself facing a crossroads that many young women encounter. She was in a relationship, a connection that made her heart flutter and her mind race with questions. Like any responsible individual, Laura wanted to take control of her reproductive health. She knew that understanding her options and making informed choices were paramount. After careful consideration and candid conversations with her healthcare provider, Laura decided that oral contraceptives were the path she would take. It seemed like the perfect solution, a method that, when taken consistently, could offer her the control she sought. With determination, Laura embarked on her journey with birth control pills. She created a system that worked for her, setting a daily alarm to remind her to take her pill, and diligently marking off each day on her calendar to track her progress. She was resolute in her commitment to never miss a single dose, and that commitment deserved applause. But life, as it often does, had its own script to follow. Despite Laura's unwavering dedication, she found herself facing an unexpected revelation, a missed period that signaled a reality she hadn't anticipated. She took a pregnancy test, and the result left her in a mix of surprise, confusion, and a tinge of worry. Laura's situation resonates with a fundamental truth: birth control pills, while highly effective, are not infallible. Their efficacy depends on a variety of factors, including consistency, timing, and even individual differences. As a seasoned gynecologist, let me emphasize that no birth control method, aside from abstinence, guarantees absolute protection. Laura's story serves as a poignant reminder that life can sometimes throw us unexpected curveballs, despite our best efforts to plan. Feeling curious and wanting to delve deeper into this topic? Perfect! It's essential to grasp the intricacies beyond the surface when it comes to contraception. For instance, you might be wondering, what specific medications can affect the reliability of oral contraceptive pills? How do particular illnesses come into play? And most importantly, how can you maximize the effectiveness of your chosen contraceptive method? Well, you're in the right place. In this video, we've delved into these very questions, providing you with insightful information that can empower you to make well-informed decisions about your reproductive health. Based on typical use, about 9 out of 100 people taking combination birth control pills will get pregnant in the first year of use. With perfect use as directed, the pregnancy rate is less than 1 in 100 people every year. Although taking combination birth control pills during early pregnancy doesn't increase the risk of birth defects, it's best to stop using the pills as soon as you suspect you're pregnant. Some advantages of the pill include: it does not interrupt sex, it usually makes your bleeds regular, lighter, and less painful, it reduces your risk of cancer of the ovaries, womb and colon, it can reduce symptoms of premenstrual syndrome, it can sometimes reduce acne, it may protect against pelvic inflammatory disease, it may reduce the risk of fibroids, ovarian cysts, and non-cancerous breast disease. Some disadvantages of the pill include, it can cause temporary side effects at first, such as headaches, nausea, breast tenderness, and mood swings. If these do not go after a few months, it may help to change to a different pill. It can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions, such as blood clots and breast cancer. The efficacy of oral contraceptive pills can be reduced due to a few factors. Here are some reasons why the effectiveness of oral contraceptives might be compromised. Missed pills. Consistency is crucial when taking oral contraceptive pills. Missing pills or taking them at irregular times can decrease their effectiveness. It's recommended to take the pill at the same time every day to maintain its efficacy. Interactions with other medications. Some medications, such as certain antibiotics, antifungal drugs, and certain seizure medications, can interfere with the effectiveness of oral contraceptives. These interactions can reduce the pill's efficacy and increase the risk of unintended pregnancy. Some interactions are with the antibiotics rifampicin and rifabutin, which can be used to treat illnesses including tuberculosis and meningitis, can reduce the effectiveness of the combined pill. Other antibiotics do not have this effect. If you are prescribed rifampicin or rifabutin, you may be advised to change to an alternative contraceptive. If not, you will need to use additional contraception, such as condoms, while taking the antibiotic and for a short time after. Speak to a doctor or nurse for advice. The combined pill can interact with medicines called enzyme inducers. These speed up the breakdown of hormones by your liver, reducing the effectiveness of the pill. Examples of enzyme inducers are the epilepsy drugs carbamazepine, oxcarbazepine, phenytoin, phenobarbital, primidone, and topiramate. Antiretroviral medicines used to treat HIV. Research suggests that interactions between these medicines and the progestogen-only pill can affect the safety and effectiveness of both. Digestive issues. If you experience vomiting or diarrhea shortly after taking an oral contraceptive pill, it might not be fully absorbed by your body, reducing its effectiveness. In such cases, additional contraceptive measures should be considered. Storage and temperature. Storing oral contraceptive pills in inappropriate conditions, such as high heat or humidity, can potentially affect their potency and effectiveness. Weight and hormonal balance. Some studies suggest that oral contraceptives might be less effective in preventing pregnancy for individuals with higher body weight. The hormones in the pill could be distributed differently in individuals with obesity, potentially impacting their effectiveness. Non-compliance. Inconsistent use or discontinuation of oral contraceptives can lead to reduced effectiveness. If you stop taking the pills prematurely or don't adhere to the prescribed regimen, the risk of unintended pregnancy increases. Medical conditions. Certain medical conditions, such as gastrointestinal disorders or malabsorption syndromes, might interfere with the body's ability to absorb the hormones from the pill, affecting its efficacy. St. John's wort and herbal supplements. St. John's wort, along with certain herbal supplements, can decrease the effectiveness of oral contraceptives by affecting their metabolism. To ensure the optimal efficacy of oral contraceptives, it's essential to follow the prescribed instructions closely, take the pill consistently, and discuss any concerns or potential interactions with your healthcare provider. If you have doubts about the effectiveness of your contraceptive method, consulting a medical professional is recommended. Risks of taking the combined pill. There are some risks associated with using the combined contraceptive pill. However, these risks are small. Blood clots. The estrogen in the pill may cause your blood to clot more readily. If a blood clot develops, it could cause deep vein thrombosis, clot in your leg, pulmonary embolus, clot in your lung, stroke, or heart attack. The risk of getting a blood clot is very small, but your doctor will check if you have certain risk factors before prescribing the pill. Cancer. The pill can slightly increase the risk of developing breast cancer and cervical cancer. It can also decrease the risk of developing womb, uterus, cancer, ovarian cancer, and bowel cancer. However, 10 years after you stop taking the pill, your risk of breast cancer and cervical cancer goes back to normal. Ladies, if you find yourself in Laura's shoes, if you've been diligent, responsible, and committed to your chosen method, please understand that you're not alone. Birth control pills are a reliable method when taken as prescribed, but they can be influenced by certain medications or health conditions. This is where our healthcare provider steps in. A candid conversation about your health history, medications, and lifestyle is essential. We're here to offer guidance, answer your questions, and help you make informed decisions about your reproductive health. Laura's journey highlights that while we strive for control, life has a way of asserting itself. And in those moments, remember that professionals like me are here to support you. We're here to navigate these complexities together, providing insight and understanding along the way. So, ladies, stay informed, stay empowered, and remember that your journey is unique. Unexpected circumstances don't define you, your resilience, your choices, and your determination do. And when you're faced with the unexpected, know that your healthcare provider is just a conversation away. As we come to the end of this video, it's clear that contraception is a topic that requires thorough understanding. Remember, if you're on oral contraceptive pills like Laura, there's a lot more to consider than just taking them on time. Factors like certain medications, illnesses, and lifestyle choices can all play a role in their effectiveness. Your journey towards a well-informed and empowered life continues beyond this video. Share this knowledge with friends who could benefit, and make sure to hit the like button if you found this information valuable. Don't forget to subscribe to our channel for more empowering content that guides you towards a healthier future. Remember, taking charge of your reproductive health is a step towards greater self-care and confidence. Stay informed, stay curious, and stay empowered. Thank you for joining us today. See you in next awesome video.